Good morning everyone, and welcome to today's lecture on the radiological aspects of pancreatitis. Pancreatitis refers to the inflammation of the pancreas, which can be acute or chronic. The radiological evaluation plays a crucial role in the diagnosis, severity assessment, and management of pancreatitis. In this lecture, we will discuss various imaging modalities and techniques used in the evaluation of pancreatitis, as well as the radiological manifestations of complications and treatment monitoring. So, let's dive into our first topic. Radiologists use scoring systems like the Balthazar scoring system to assess the severity and predict the course of pancreatitis. MRI and use can provide additional information. Radiological imaging techniques are crucial for diagnosing, staging, and assessing complications in acute pancreatitis patients. In the evaluation of acute pancreatitis, the Computed Tomography Severity Index, CTSI, is an invaluable tool. CTSI is used to assess the severity of pancreatitis based on the extent of pancreatic necrosis, parapancreatic inflammation, and complications. The CTSI score helps guide the treatment approach and predict patient outcomes. CTSI takes into account various radiological findings, such as the presence of pancreatic necrosis, parapancreatic fluid collections, and extrapancreatic complications. The scoring system classifies patients into mild, moderate, or severe categories, aiding in the management decisions. Contrast-enhanced CT imaging is widely used in the evaluation of pancreatitis as it provides additional information about the vascular supply, perfusion, and enhancement patterns of the pancreas. The administration of intravenous contrast during a CT scan allows for the visualization of arterial and venous phases, aiding in the detection of ischemia, necrosis, and vascular complications. It also helps in distinguishing between active inflammation and scar tissue in chronic pancreatitis. Magnetic resonance imaging, MRI, is a valuable imaging modality for the evaluation of chronic pancreatitis. It provides excellent soft tissue contrast and multiplanar imaging capabilities, allowing for better visualization of the pancreatic ductal system and associated complications. MRI is particularly useful in detecting chronic changes in the pancreas, such as pancreatic atrophy, fibrosis, and calcifications. The utilization of specific MRI sequences, such as Mr. cholangiopancreatography, MRCP, helps in assessing the pancreatic ductal anatomy and identifying any strictures or obstructions. Endoscopic ultrasound, EUS, is a minimally invasive imaging technique that combines endoscopy and ultrasound to evaluate the pancreas and surrounding structures. EUS provides high-resolution imaging, allowing for detailed visualization of the pancreas and detection of small lesions or abnormalities. In pancreatitis, EUS plays a crucial role in the identification and characterization of pseudocysts, fluid collections, and strictures. It can also guide interventions, such as fine needle aspiration, FNA, for cytological analysis or drainage of fluid collections. In acute pancreatitis, radiological imaging is crucial for identifying and managing complications like pseudocysts, necrosis, abscesses, and vascular issues. CT and MRI scans provide important information about the size, location, communication, chronicity, and infection within these complications, and interventional radiology techniques can be used for drainage and management. Interventional radiology plays a crucial role in the management of complications associated with pancreatitis. Procedures, such as percutaneous drainage and abscess aspiration, are commonly performed under imaging guidance. In complex cases, endovascular techniques, such as embolization, may be used to control bleeding or manage vascular complications. Additionally, interventional radiology may be involved in the placement of biliary stents in patients with obstructive jaundice due to pancreatitis. Pancreatic necrosis, a severe complication of pancreatitis, requires accurate and timely imaging evaluation. Both CT and MRI can provide valuable information regarding the extent, location, and presence of infected necrosis, aiding in the appropriate management. CT is often the initial imaging modality of choice, allowing for quick assessment of necrosis, presence of gas bubbles, and complications such as abscesses. MRI, with its superior soft tissue contrast and multiplanar capabilities, can further characterize the necrotic areas, differentiate between sterile and infected necrosis, and guide interventions. Pancreatic pseudocysts and fluid collections are common complications of acute and chronic pancreatitis. These fluid collections can cause symptoms and may require drainage or intervention. CT and MRI play a significant role in the evaluation of pseudocysts and fluid collections. They aid in characterizing the size, location, and presence of communication with the pancreatic duct. Interventional radiology techniques, such as percutaneous or endoscopic drainage, may be utilized based on the imaging findings and clinical presentation. Imaging plays a crucial role in the evaluation of the pancreatic ductal system in pancreatitis. Accurate assessment of the pancreatic ductal anatomy and the presence of strictures, obstructions, or leaks are essential for proper management. MRCP, a non-invasive MRI technique, is commonly used for visualizing the pancreatic ductal system. It allows for the identification of strictures, ductal dilatation, or calculi. Additionally, endoscopic retrograde cholangiopancreatography, ERCP, may be performed to further evaluate the ductal system and facilitate interventions such as stent placement or direct ductal visualization. Autoimmune pancreatitis is a distinct form of chronic pancreatitis characterized by immune-mediated inflammation. Radiological evaluation plays a crucial role in the diagnosis and differentiation from other forms of pancreatitis. CT and MRI are the mainstay imaging modalities used in the evaluation of autoimmune pancreatitis. The typical imaging findings include diffuse pancreatic enlargement with a characteristic sausage-like appearance, ductal strictures, parapancreatic inflammation, and associated vascular involvement. These findings, along with serological and histological analyses, contribute to the diagnosis of autoimmune pancreatitis. Radiological imaging plays a vital role in monitoring the treatment response and disease progression in pancreatitis. Follow-up imaging allows for the evaluation of treatment effectiveness, identification of complications, and planning further interventions, if required. CT and MRI scans are commonly utilized at regular intervals to assess changes in pancreatic size, necrosis resolution, pseudocyst regression or recurrence, and improvement in vascular complications. These serial imaging evaluations help guide clinical decision-making and ensure appropriate management. In conclusion, radiology is vital in diagnosing and managing pancreatitis. CT, MRI, use, and interventional radiology provide accurate diagnosis, complications assessment, and treatment monitoring. Collaboration between radiology, gastroenterology, and surgery is vital. Thank you for watching.